keeping up with all the breakthroughs happening these days, I mean, it can feel like you need a PhD just to get what the headlines are even saying.
Right. It's like every day there's something new.
So today on the Deep Dive, we're giving you that shortcut, that cheat sheet you need. We dug into the research on something truly revolutionary: artificial intelligence in healthcare. And this is not just another tech trend. It's totally changing how medicine is actually done.
Yeah, we're talking about like a fundamental shift. We went through a ton of research articles, so you don't have to.
That's right.
Goal is to get the clear picture. What are the mind-blowing things it can do right now, and what might the future hold?
It's going to be big.
Think of this deep dive as your express lane to a field that's quickly becoming essential for all of us.
Let's jump into the present and see what AI is doing in healthcare today. Machine learning and neural networks, those are driving a lot of this, right?
They're the engine, for sure.
One of the areas where these machine learning techniques are really making a difference is in radiology. They're helping doctors understand all those complex images.
Big time. Traditionally, radiologists, they use their training and experience to compare images, find anything unusual.
Right.
Now you've got computer-aided detection, CAD, which is machine learning highlighting areas in the images that might be a problem. It's like a second set of eyes.
Okay.
It draws their attention to things they might miss, so hopefully there are fewer missed diagnoses.
That makes sense.
It's not about replacing radiologists, though.
Just helping them, right?
Exactly, just giving them more support. And we're even seeing systems that can automatically detect some conditions in pathology.
Oh, wow.
Yeah, since the 70s, there have been algorithms using pixel analysis to spot irregularities in digital slides from biopsies and stuff.
Right.
Trying to find things like cancer cells. And now there are even more advanced algorithms that can understand MRIs and ultrasounds with an accuracy that's getting close to what experienced doctors can do.
That's impressive. And dermatology is another area where machine learning is making huge strides, especially in detecting skin problems.
Skin cancer is the most common type of cancer, so it makes sense that AI would be helpful there.
Yeah.
They're training CNNs on these massive data sets of images, both healthy skin and all sorts of skin conditions, so they can learn to recognize and classify them.
You mentioned the googly Inception V3 model. Wasn't it trained on like 1 million regular images and then tons of dermatology images?
Right, over 1 million general images and something like 129,000 dermatology ones.
And it got diagnoses as accurate as a dermatologist.
It did, yeah. That study was a game changer.
Wow.
It showed that AI can be as good as the experts in a specialized field. Another example is a CNN they trained on almost 50,000 images, and it could accurately detect on onychomycosis, a nail fungus, just from photos patients took.
Just from a photo?
Yep. And its accuracy was even better than most of the dermatologists who were part of the study.
That's crazy. So we've talked about radiology and dermatology, but machine learning is being used for so many other healthcare challenges, isn't it?
Oh, absolutely.
Predicting who's at risk for diseases, helping sort patients when they come in, even genetic engineering.
All sorts of things. As AI gets better and becomes more embedded in healthcare, we're going to see even more innovation and applications that really change things, all with the goal of better patient care and better health outcomes for everybody.
One of the exciting areas where AI is already making a difference is in personalized medicine, moving away from that one-size-fits-all approach.
Yeah, personalized medicine is about tailoring healthcare to each person based on their genes, lifestyle, environment,
Right.
all that stuff. And right now, there's this huge surge in that kind of data because of things like wearable tech, genetic sequencing, and electronic health records.
But that's a lot of data, right?
It's a deluge. We're collecting it faster than we can analyze it.
So how do we even process it all?
That's where AI steps in. AI can actually tackle that data overload by making the info better and easier to use.
Like AI is organizing the data for us.
Exactly. There are AI techniques that can automate the cleaning, the organizing, and standardizing data from everywhere. That's super important for actually doing something with the information. For example, you've got generative adversarial networks, GNs, and autoencoders.
Those are tough words.
They are, but they're showing a lot of promise in their ability to fill in missing data and fix errors in records.
So AI isn't just analyzing the data, it's making the data itself better and more useful. You also mentioned that different AI techniques are good for different types of medical data.
That's true.
So can you talk a little bit more about that?
Yeah. Machine learning is great for things like histological images, those microscopic images of tissues,
Right.
and for all that data from genomic sequencing.
Okay.
Then you have natural language processing, NLP, which is perfect for working with text, like the notes in electronic health records.
Makes sense.
And of course, computer vision is essential for analyzing medical images. But these aren't strict categories.
They can overlap.
They can. You can use multiple techniques on the same data to get different insights.
So you had some interesting examples of personalized medicine in action. For instance, CNNs being used for skin cancer classification. How does that contribute to personalized medicine?
Well, that application is all about improving the accuracy and speed of early skin cancer diagnosis. Early detection often means you can have less invasive treatments that are tailored to this specific type and stage of cancer.
And it's personalized, right?
Exactly. It also expands access to expert-level diagnostics, even in places where there aren't enough dermatologists.
That makes a huge difference. Another example was using reinforcement learning for AI-driven cognitive behavioral therapy for chronic pain. How does AI personalize mental health treatment?
So reinforcement learning lets the AI adjust the CBT strategies based on how the person is responding during the sessions.
So it's constantly adapting.
It is. That creates a much more personalized experience compared to regular CBT, which is often more standard.
Okay. What about natural language processing to make the referral process better for people who might need epilepsy surgery?
So NLP algorithms, they can look through a patient's medical records and find subtle clues that might suggest they would benefit from surgery.
So they're looking for patterns.
They are. This makes sure that high-risk individuals are identified and referred for specialized care quickly.
Okay, that makes sense. There was also an example using guided image filtering to help differentiate between ulcerative colitis and Crohn's disease. How does that lead to more personalized treatments?
Distinguishing between those two conditions is important because the treatments are different, but the symptoms can be similar.
So it can be tough to diagnose, right?
It can. Guided image filtering makes the diagnosis more accurate, so the treatment plan is specifically for the correct condition.
You had one more example, the random forest machine learning model for choosing chemotherapy for gastric cancer patients. That sounds like a direct application of personalized medicine.
It is. It analyzes the genetic profile of the patient's tumor to predict which patients are most likely to respond to a specific chemo drug, paclitaxel.
Okay.
So oncologists can choose the most effective treatment for that individual and potentially avoid using drugs that won't work and might have bad side effects.
It's like customizing the treatment.
Exactly.
So these examples really show how AI can turn tons of data into insights that are specific to each patient. And it's not just about analyzing what we have, right? AI is becoming more important in genomics and proteomics too.
Absolutely. In genomics, AI can analyze DNA sequences to find variations that might make someone more likely to get certain diseases.
So it's predicting future risk.
It is. And that helps with diagnosis, risk prediction, even finding targets for new treatments.
Wow.
In proteomics, AI is analyzing proteins to find variations that could be biomarkers for health conditions.
So it's like looking for clues in the proteins.
Exactly.
And we talked about AI predicting how someone might respond to a drug.
Right.
Is that where electronic health records come in?
Exactly.
I love
Electronic
that.
health records are packed with data.
They are.
AI can go through all that and find patterns that help make clinical decisions and personalized treatment plans.
That's huge.
For example, some NLP algorithms are being used to look for specific risk factors for delirium in patient notes.
So they're scanning for things that might not be obvious.
Right.
Okay.
That helps with early intervention and potentially better outcomes for those patients.
So AI is not just looking at the biology of disease, it's looking at psychological and social factors too, right?
Exactly. It's about seeing the whole picture.
That's impressive.
In mental health, for example, AI chatbots and virtual assistants are giving people more support.
So AI is like a therapist now.
In a way, they offer personalized strategies based on CBT and help keep people engaged with their treatment.
And what about those social determinants of health you mentioned?
Right. There's research looking at factors like stable housing, reliable transportation, and good nutrition on top of a patient's medical history to predict hospital readmissions.
That makes sense.
By considering those social factors along with the medical data, AI can identify high-risk patients and then connect them with social services. It can even suggest treatments that are easier for them to access.
So it's taking everything into account.
It's about the bigger picture.
That's amazing. Now let's talk about how AI is impacting immunization.
Immunization is huge. There are millions of kids around the world who don't have access to vaccines.
It's a problem.
The COVID-19 pandemic really showed us how fragile our vaccination systems are.
Definitely.
And how much we need new solutions. Digital health interventions, especially with mobile phones, are becoming more and more important in closing those gaps.
Right.
And improving how well vaccination programs work.
And this isn't just about routine childhood vaccines.
No.
The COVID-19 vaccine rollout really boosted the use of digital tools for our immunization information systems.
It did. We know that paper-based immunization records can have a lot of errors.
Oh, yeah.
Going digital helps capture data more accurately when people are vaccinated.
That's important.
Cloud systems, mobile apps, using 2D barcodes to scan vaccine vials and IDs. These things help minimize errors and make data entry easier.
So we're collecting the data better.
Yeah.
But how does that translate to real-time monitoring of vaccination efforts?
So you've got these digital tools like interactive dashboards and GIS, geographical information systems.
Those give a good visual, right?
They do.
Yeah.
They give policymakers and public health officials real-time information about vaccination campaigns.
So they can see what's working and what's not.
Exactly. They can track coverage, find areas where vaccination rates are low, and even spot outbreaks of vaccine-preventable diseases faster.
That's huge.
And AI can analyze this real-time data to predict where resources are needed and target reminders in campaigns.
You gave that example of polio eradication in Africa, where mobile phones and GIS were so important.
They're essential.
Okay.
These tools have been so valuable in tough environments.
Right.
And we all saw how important those public data dashboards were during COVID-19.
For sure.
They tracked the virus's spread and how vaccines were being distributed globally.
The Johns Hopkins University dashboard comes to mind.
A great example. That became a go-to resource for millions. It showed how powerful it is to make data visual so people can understand and respond to a crisis.
So we've come a long way in how we handle public health information. Now let's talk about telemedicine.
Okay.
It's been around for a while, but the pandemic really boosted its use. Can you give us a rundown of what we mean by telemedicine and telehealth?
Sure. The World Health Organization says telehealth is delivering healthcare services over a distance using tech.
Makes sense.
The Federation of State Medical Boards gets more specific and says telemedicine is practicing medicine using electronic communication between a doctor and a patient who are in different locations.
So it's about using technology to connect.
Exactly. We'll use telemedicine as a general term covering both.
Okay, that's helpful.
Telemedicine has made healthcare more accessible, especially for people in rural areas, those with transportation problems, and those with disabilities.
It can also be more cost-effective.
Absolutely. It saves time for both patients and doctors.
And during the pandemic, it was crucial for reducing the risk of infection.
Huge for that. We saw a massive jump in telemedicine use during COVID-19.
Definitely.
It was how people got care when they couldn't see their doctor in person.
Things changed quickly.
They did. Expanding insurance coverage for telemedicine, allowing interstate care, relaxing HIPAA rules, all that helped make the shift happen.
It had to happen.
It did. And the data shows telemedicine use has stayed high even after the worst of the pandemic.
So people are getting used to it.
They are. Mental health conditions have been a big reason for those visits.
Telemedicine also played a big part in managing the pandemic itself, right?
Absolutely.
Things like those forward triage systems.
Yeah, those are key.
They let doctors assess patients remotely and decide what kind of care they needed.
It took pressure off emergency rooms, limited the virus's spread in hospitals, and helped conserve PPE.
It was even used for inpatient care, right?
It was.
To reduce infections in the hospital.
Exactly.
It seems like telemedicine was good for healthcare workers, too.
There's research suggesting that.
It gave them more flexibility and control over their schedules.
Right, which could lead to less burnout.
That's important.
It is. So now let's look at how AI is boosting telemedicine.
It's not just virtual appointments anymore, is it?
No, it's so much more. AI is taking telemedicine to a whole new level. AI algorithms can learn from tons of data and analyze complex information really fast.
Right.
That saves time and money, and it helps doctors make better decisions remotely. AI has become really good at interpreting medical images remotely.
You mentioned the FDA has approved AI algorithms for diagnosing all kinds of conditions: strokes, hemorrhages, cancers, COVID-19.
The list goes on. That shows how much progress we've made.
It's incredible. And that ability to diagnose things remotely can lead to earlier interventions, which can make a huge difference for patients.
Absolutely. AI also makes store and forward telemedicine more efficient because it can interpret images and other data quickly.
So it's speeding things up.
It is. And it's also playing a bigger role in remote patient monitoring with things like smartphones and wearables.
How so?
Well, AI can analyze the data from wearable devices like smartwatches.
Right, they're collecting all sorts of data.
They are. So the AI can monitor vital signs and detect things like atrial fibrillation early on. AI can also help people stick to their medication regimens, things like video verification that they took their meds.
That's interesting.
And there's even research on using AI to assess COVID-19 risk based on changes in people's voices.
Wow. As those sensors in our phones and wearables get better, we're going to see some amazing applications.
Absolutely. And don't forget about the AI chatbots in telemedicine.
Oh, right. Those are becoming more common.
They are. They're being used for all sorts of things, from screening and triage, which was huge during the pandemic,
It was.
to giving people their genetic testing results and answering basic health questions.
It's like having 247 access to medical info.
Exactly. And some of them are really accurate. There was a study that looked at the diagnostic abilities of one of those large language models.
You mean like ChatGPT?
Yeah, something like that. It showed potential, but it also highlighted the need for doctors to be involved.
That's reassuring.
AI can't replace doctors' judgment and experience.
Right, it's a tool.
Exactly. It needs to be integrated properly.
That makes sense.
And AI is being used to help diagnose a wide range of conditions, from mental health issues to neurological disorders, even appendicitis. It's using different types of data to make those assessments.
AI can help with all that.
It can. And it's also being used to automate things like classifying pathology reports, finding medical codes, and even making diagnoses based on clinical notes.
It's like AI is becoming part of the healthcare team.
In a way. But it's important to remember that more research is needed to make sure these systems are accurate and safe before they're widely used.
Of course, safety first.
And there are challenges to implementing AI-based telemedicine.
Like what?
Well, some people aren't comfortable with technology, and not everyone has access to it. We need more policies and regulations that support this kind of care.
Right, and there are privacy and security concerns too.
Absolutely. Plus, there are practical issues like battery life, device compatibility, and internet access, especially in rural areas.
Those are all important.
They are. To overcome these challenges, we need designs that are user-friendly, funding to bridge the digital divide, strong data protection, and systems that work on different devices.
Right, it needs to be accessible.
It does. The goal is for AI in telemedicine to help healthcare professionals, not replace them.
That's key. Now let's move on to patient engagement and medical education. Chatbots seem to be a big part of those too.
They are. The pandemic really showed us what they can do.
It did.
They can boost patient engagement, provide mental health support, and make communication better.
You mentioned Watson Assistant, which handled millions of COVID-19 responses. That's amazing.
It really was. It seems like chatbots can also help people understand their care better and follow their treatment plans.
So they're encouraging people to be more involved in their own health.
Exactly. They can provide information at any time and explain things in a way that's easy to understand. That's huge, especially because so many people struggle with medical jargon.
Robot is a good example, right?
It is. It uses CBT, and it's had positive results with college students who are feeling depressed.
This is like a digital therapist.
In a way, its conversational style and the regular check-ins seem to help keep people engaged. It's also shown promise in reducing drug cravings and easing anxiety.
And it's being used with teens who have special needs, helping them take better care of themselves.
Yeah, that's encouraging.
It seems like chatbots could be really good for sensitive topics where people might feel awkward talking to a person.
They can provide that safe space. But there are some concerns too.
Like what?
Well, they might make health disparities worse for people who don't have tech access or skills. And even though they can try to simplify complex medical language, there's a chance they could be inaccurate or leave out important info.
They're not perfect.
They're not.
And ChatGPT and Bard, even though they're really knowledgeable, their answers aren't always consistent, right?
That's true. So, while chatbots are exciting, we need to be careful and keep researching them.
Makes sense. Now, what about AI in medical education?
That's where the future of healthcare is being shaped.
How is AI changing how doctors learn and how educators teach?
There are two main things to think about.
Okay.
First, how can educators use AI tools to make their teaching better?
Right.
And second, how do we change med school to make sure future doctors can use AI effectively and ethically?
Those are big questions.
They are. Interestingly, AI took a while to make its way into medical education.
Really?
Yeah, there was some hesitation early on.
I guess it was a new thing.
It was. But now that AI is becoming so important in healthcare, there's a push to include it in training.
So future doctors are ready.
Exactly. AI can bridge that gap between traditional lectures and more personalized learning.
So it can customize education.
It can. It lets students learn at their own pace and focus on what they need help with.
That's great. But is there enough info on how to actually implement AI in medical education?
That's something we need more of. A lot of the information we have now is from individual experiences.
Anecdotal.
Yeah.
One of the most talked about uses is personalized learning and feedback, which can be hard for faculty to do consistently.